Welcome, everyone. Thank you for joining this morning. I got a chance to meet most of you this morning, and I appreciate all of you making time to come for a really nuanced topic, acknowledging that Asian American Pacific Islander substance use is probably a topic that isn't talked about too frequently, even in our medical communities. My name is Warren Yamashita. I'm a family medicine, addiction medicine physician. I practice currently in Santa Ana, moving to Los Angeles in the next month or so. Really excited to share about this topic. Part of my move to LA is actually looking for a clinic that serves more of an AAPI population to really try to build an AAPI substance use disorder panel. And I also serve as adjunct faculty at Stanford's Addiction Medicine Fellowship. That's some like fellowship addiction medicine trained. And there I work with the fellows teaching the stigma and disparities, the DEI curricula with them. Let me see if I can get my mouse to be my clicker. All right, well, since we have a smaller group for this nuanced topic, I really want to just encourage engagement. If there's slides that pop out you want me to elaborate more on or have a question on or even an insight from your own clinical experience and regions, hopefully try to make this as conversational as possible. For this presentation, I have no disclosures. We will be talking about a study that I'm conducting with a group where some quotes do talk about trauma, neglect, and abuse. So just some discretion with that. This talk really is the sequel or the second part to the talk I gave last year at the conference. I actually put up the QR code. I'll make the slides available. If you could view that presentation recording on my Google Photos. But that talk was a more global conversation about addiction stigma and racism in America. We took a historical look at that across the last couple centuries. Very hot topics, and for that topic, the room was packed. But I'm actually more excited for this topic because this topic is very nuanced. But this presentation gives a lot of context to how I approach this topic in the larger conversations of addiction stigma and racism in America. I think some elements I want to pull from last year just into our conversation today is the two stigmas were addiction stigma and racism and racial bias in America, how that kind of stemmed back even to 1870s at the start of the nation as we imported slavery and as addiction was really looked at as a moral failing, and how we're still dealing with those two stigmas today. Through that presentation, I talked about two movements of the heart to address those two stigmas. And the first one is really had some glasses that we put on and really taking off our stigma glasses, recognizing that we live in a fallen world. And we, in our own minds, we have a lot of cognitive biases and stereotypes of how to categorize just people that look like, just based off how we look, no matter what race, ethnicity we are. And how do we take off those stigma glasses and start to put on the glasses of the Father's eyes as we look at others, and really learn the nuanced life stories of each person and eternal human being that's standing in front of us. So kind of two movements, kind of taking off the stigma glasses, putting on the Father's lens, even as we engage our clinical work and even work with navigating kind of these perceptions of AAPI and within our broader society. This was a fun slide to kind of put together from just movies and Netflix. I tried to find AAPI TV shows and movies. But yeah, I think what we're seeing in media is a lot more representation of AAPI. And so more narratives being told to the larger public about just this large group of people. Even if you don't, your regions, I think I was looking like Kentucky had like 1.5% AAPI in the population. Ohio was like 2.7%, but you were sharing that Columbus, like some, just depending on the cities might have more AAPI. So regardless, we are actually, kind of hearing more stories about these communities. I think just some things that I noticed that there's still like a lot of caricaturizing. Even Asian actors and actresses still fit like these stereotypical roles too. But it's kind of this context for even just society's conversation of this group as we kind of dive into a topic about substance use. So our goal with this talk is to really discuss some of the historical, scientific, and cultural considerations for treating substance use amongst Asian American Pacific Islander populations. In the context of our mission at CCHF to envision a movement of God's people who choose daily to promote healing in marginalized communities in the name of Jesus, it really contextualizes this talk's goal to kind of what I kind of call it like a forgotten goal, which is to explore what is lost when we ignore the diversity of God's people and how colorblindness can adversely affect morbidity and mortality. And especially with something like substance use, it kind of can help surface that. And the reason why I kind of consider this the forgotten and self-evident goal is that sometimes that, throughout Scripture from start to finish, God's vision for all his peoples has always been, to bless all the nations, from Genesis, promising to Abraham through his offspring to bless all nations. And then in Revelation 7:9, really painting that, I'm sure we've all seen like pictures of people's interpretations of 7:9 of just a multitude of people from every nation and all tribes and peoples and tongues worshiping God together in unity, but in diversity, worshiping in even different languages. I think one of the frame, kind of as I mentioned, like the two movements of the heart, kind of taking off the stigma glasses, putting on the lens of the Father, is hopefully the lens that we can approach even this nuanced, even academic topic with, is as we put on the lens of the Father, really seeing the beauty of the color in which how God's made people so uniquely and so beautifully. And I just we want to avoid like spiritual shortcuts, saying just because we came to Christ, now we all know everything. Like there's still a lot of learning and entering each other's lives. I like how Suyan put it this morning about maybe we all have a God-shaped hole in our hearts, but maybe God's put like people-shaped holes in our hearts to get to know the neighbors and the people around us. And so I think appreciate the time that you've all taken this morning, because there's a lot of cognitive burden with, it's like, sometimes I feel this as well. It's like, all right, so I need to learn this, and this about it's so much to keep track of and learn, but hopefully we can approach it with the posture that's less burdensome and more celebratory of getting to just enter into each other's stories, hearing from each other's experiences. And so we'll be going through just a brief literature review of the current literature on API substance use, critiquing some of the limitations within the current literature, and then I'll be presenting on some preliminary findings on a qualitative study that I'm conducting with Stanford and UCLA partners on this topic. So according to the US Census, just basic definitions, they define Asian Americans as originating, or their families originating from certain regions in the Far East, Southeast, and Indian subcontinent, and then Native Hawaiian and other Pacific Islanders originating from Hawaii, Samoa, Guam, or other Pacific Islands. And so you can see these four letters API capture really so many different people, and people that really kind of have nothing to do with each other from really different regions all over the world. So the usual background in the literature, and I'll just kind of click through these slides, is basically Asians don't use drugs, is typically how the epidemiology studies go. So here's one study noting that Asian Americans had the lowest past month prevalence of alcohol use and other drug use for alcohol binge, alcohol use, and illicit substance use. Another study found that from ED admissions, Asian Americans, Pacific Islanders had the lowest rate of substance use disorder diagnoses during ED admissions over a year. And in the context of this recent opioid overdose crisis that all our communities are facing, I bolded the AAPI row near the bottom, showing that AAPI have the lowest rate per 100,000 of overdoses from any type of drug, so 3.3. So oftentimes, even in the field of addiction medicine, and when I go to the addiction medicine conferences, it's not really talked about. Even when we talk about communities of color getting more affected, even post-pandemic, by substance use, we don't really talk about it. Really excited that one of my research partners that's on the study with me, she's going to be presenting, she's collaborating with four other AAPI to talk about AAPI substance use at the May American Psychiatric Association National Conference. So it's getting some more traction. Typically, we just don't talk. It ends here, kind of the classic. I could end the presentation here. We're done. Okay, there's no problem. There's nothing to explore, but a large movement going on now is really a call to just aggregate the data, noting that API is such a large category, it's almost, in some sense, meaningless to talk about all these people lumped together in one bucket because they're so diverse. And so, for one reason why all these people were lumped together is studies like to get statistically meaningful results. So they clump everyone together to try to get larger sample sizes, and that's and they're either categorized as API in the literature, or sometimes it's just they kind of fit into this other bucket as well. Did you have a
question? To qualify, to identify as specific race or ethnicity, is it how many generations back? It's like, for example, my father was 50% Italian.
Hmm.
So I'm 5%. My kids 12%. So at what point we say, you're really not, Asian, or because you're like seventh generation Asian. So how do the studies differentiate like true genetic variability?
Yeah, that's a great question, and I guess just for the recording, just the question was like, at what point do you still categorize someone as Asian API based off the generation or the percentage? Yeah, and that's a good question. I think it's you mentioned at the end, like genetically, there's probably that's a good, and so define the research question. So if it's genetically for some like pharmaceutical study, then they'll need to kind of just define the definition and then sort the sample size, but yeah.
The question is, from a cultural standpoint, there's this cultural evolution that happens. In most families that come to a cultural gathering, at some point, that behavior shifts to acclimate to the culture.
Yeah.
That's part of my question, sort of generational presence.
Yeah, I love the question from the cultural end because it's really a evolving dialogue, right? It's, now there's kind of a move to even kind of, instead of talking about people like first, second gen, there's like 1.5 or generation to really kind of capture a lot of the nuance. And so, so it's real, I don't have the answer for that. And a lot of it's, it's like, especially at CCHF, I kind of define as, how people understand their life story, like understanding their identity as God made them, and oftentimes exploring your background, no matter where you're from, can just unearth such beauty in how God made you, what He thinks about you, what He thinks about your family. And I would even argue that's probably the lens we should approach. Is we should be willing to learn more about our background, to even kind of unsurface more about how God has made us and who we are. So we talked about the idea of data aggregation, and one thing to note on this is even doing this research study, I found out that no one tries to do a research career on Asian American substance use. It's kind of like a non-starter. No one ever wants to. They're like you can never get a career. You can never get paid to do this work. Some random studies have been done here or there, so we can go through some of these that really highlight how diverse this large category of people are. So one study noting, and this depends on region, depends on the time the study was done, but a study noting that Pacific Islanders have higher rates of substance use than other Asian Americans, Filipino Americans having similar rates of substance use compared to white Americans versus other Asian subgroups, which really begs the question, are we disservicing certain populations by lumping them into a larger category that then ignores the problem? Higher rates of substance use tends to occur with acculturation. So when people become born in the US, have higher English proficiency, males, also a history of depression, younger age too. There's a lot of even really nuanced. This was a Los Angeles study looking at actually interviewing Korean Americans at Korean American churches, noting that a lot of the drinking culture was imported from Korea, the country of Korea. So the culture itself being very nuanced, even though they're living in America. And another study noting that there's a lot of diverse reasons why API would describe why they use substances, and that can depend on their ethnicity, gender, immigration status, and age. So I think all of these studies really show, there's so much to explore, but but you kind of have to go deeper into it. So let me just switch back here. So, as we're looking at this in the medical literature, there's been more media articles that have been kind of talking about this conversation also of how we really need to disaggregate the data because the API is just kind of a meaningless topic. And this one New York Times article talked about the movie Rich Crazy Asians. I think at the time I heard a lot of the API community celebrated as being more representation in Hollywood, but then this article kind of unpacked, it really kind of reinforces this idea of a very limited idea of the model minority idea of rich Asians from a Singaporean family. The article goes into how this API category actually has the largest income inequality. So, just really capturing the diverse experiences of socioeconomic experiences of these families. And then even comparing on the x-axis education or educational college degrees, and then y-axis income, noting that there's just such a great diversity even amongst API, with maybe Indian Americans being on the higher end for both categories, and then Burmese, you're talking about Burmese, Cambodian, and in your area being on the lower end of lesser education and more poverty. And so we can see that, again, it just, there's such a wide array of experiences. And I think the immigration lens also helps see that a lot of people and their families have very different stories. So in the 80s and 90s, especially during Vietnam, a lot of Asians coming over as refugees during wartime, and then also following them, more refugees coming in from Thailand, Philippines, and Pakistan. But more recently, the U.S. trying to get more skilled labor with H-1B visas, so more immigrants coming who aren't refugees, but coming electively with these skilled labor visas from China, India, Bangladesh, and Japan. So depending on the region, it can be very different. Just for myself, I'm a fourth generation Japanese American that had a lot of families come over during a 1920s farming diaspora. A lot of poor farming families moved over in the 1920s. Depending on your region, it's nice because you all represent so many different areas. We can see Asians tend to be more concentrated on the coastal areas, with Hawaii and California having amongst the highest rates of Asian Americans. And so, I think this even acknowledges, even at CCHF, some of you mentioned, you may just have 0 or 1 patient that identifies as API. Like I mentioned, a lot of news articles have been unpacking this idea further and even talking more about this model minority myth. And here's some, I put a QR code for one article that was kind of nice to unpack just to kind of dispel this model minority myth idea. This one Time article talks about how kind of having this one model minority stereotype kind of really disservices everybody, Asians and everybody, whites, blacks, Latino, everybody in America. This NPR article kind of unpacks that further, talking about how Asian Americans are kind of used as a racial wedge to even increase animosity between white and black Americans. This Washington Post article really was interesting, talking about kind of how the U.S. shifted Asian perception, because during World War II, Asians were hated. Some of you may know that Japanese Americans were forcibly removed out of their homes, incarcerated during World War II, and all my great-grandparents were, and grandparents were. So how did we go from a place where Americans hated Asians to now where now they're like celebrated on Netflix? And that article kind of unpacks it from a historical lens. These articles, sorry. Okay. These articles actually point back to actually post-World War II, when America defeated Japan and needed to improve U.S. relations with Japan and the international economy. And they needed to shift American perception to be less racist to facilitate those global relations. And so they talk about how a lot of news articles started to put messaging out to create this kind of model minority concept post World War II, noting one of the first heralding articles was a New York Times article in 1966 written by William Peterson. I hate reading it, but I think it's better. You'll get it better if I just read it versus trying to paraphrase it. So he says, again, this is post World War II, asked which of the country's ethnic minorities has been subjected to the most discrimination and the worst injustices, very few persons would even think of answering the Japanese Americans. Yet if the question refers to persons alive today, that may very well be the correct reply. Like the Negroes, the Japanese have been object of color prejudice. When opportunities, even equal opportunities, are opened up, the minority's reaction to them is likely to be negative, either self-defeating apathy or a hatred so all-consuming as to be self-destructive. For the well-meaning programs and countless scholars' studies now focused on the Negro, we barely know how to repair the damage that the slave traders started. The history of the Japanese Americans, however, challenged every such generalization about ethnic minorities. The reason why for me this has such a visceral disgust is because I hate how America has used Japanese Americans as a racial wedge to put down blacks in this country. And this is, you can see how he's basically saying, well, the Japanese were interned, and look, they're model minorities. They're not complaining. They're pulling themselves up by the bootstraps. Why can't blacks do that? And it's just, this is 1966, and so you're starting to see these narratives forming in America that we just live in today as our cultural milieu that we live and breathe and swim in. And that this article kind of heralds, at least in kind of a shift, because before that there were these cartoon caricatures, some about minorities, people of color who use substances. In the talk I did last year, we talked about how, at the turn of the 20th century, blacks that used cocaine were described as being dangerous threats to raping white women, and how there were Chinamen opium dens and caricatures of that in the media, and even this other cartoon of Latin American marijuana smokers, so people of color who use substances being looked at as criminals, violent, degrading society. And while we would like to say that we've matured and moved on, we've just gotten smarter, and I think a lot of the conversations we're having today is that racism maybe has been less overt and has now been more discreet and kind of a lot more subtle. And so this is an interesting study done recently by Julie Netherland and Helena Hansen, a qualitative study analyzing 100 media articles just in the news that covered the prescription opioid crisis from 2001 through 2011, again 100 articles. And the qualitative analysis found that they kind of lumped into two categories and two narratives. One category was sympathetic portrayals of suburban and rural white prescription opioid users seen as victims, innocent victims, while another subset of articles talked about criminalized urban Black and Latino and illicit heroin injectors. So you can see, even though there may not be these cartoons displaying the same ideas, our media coverage still has these same narratives being told of people of color being dangerous, violent criminals when they use substances, but that not being the case for white Americans. And we kind of talked about a little bit more in the last year's talk about how this is actually institutionalized within our medical system and criminal justice system, within even the way the FDA is structurally constructed and the DEA is structurally constructed in America. And so, you know, kind of acknowledging the milieu we live in today, and part of the idea, last year I quoted Luckin Wittgenstein, philosopher of language, who said that the limits of my language mean the limits of my world, noting that the worldview that we have really shapes how we interact and how our structures are created in the world we live in. There has been some academic articles, medical articles, talking about the model minority myth. So coming back to how the implications for these perceptions, how does this affect Asian American Pacific Islanders in the substance use research? These articles described that the model minority myth in the literature talks about the idea of Asians comprising of a racial minority group that has, quote, made it in America through hard work, education, and serve as a model for other racial minorities to follow. Another put that the model minority myth, this idea that Asians are academically and economically well off, assumes that Asian Americans experience positive protective factors associated with genetics or culture that contribute to high achievement and low incidence of mental health problems in comparison with white and other ethnic and racial groups. So you can see how this lens really is kind of a lens and what that really kind of blinds or the literature that we read. I'm going to go into some studies that kind of unpack this and really refute those earlier prevalence studies saying that, you know, Asians don't use substances, they don't have overdoses, there's no problem here. Several studies note that we really just haven't put funding and time to actually study this problem. One study noting that particularly this bias against Asians, because of this tendency to view Asians as model minorities, really causes drug use behaviors among them to be ignored by health professionals, researchers, and community members and other Asian American community members. The NESARC, the NIAAA epidemiology studies, these are the national epidemiology studies on substance use in America, note that they do undersample Asian American and Pacific Islanders. Even within Asian American communities, there's also a lower perceived need for their need for substance use treatment. One study noted that API that have methamphetamine use are less likely or report a lower need to seek treatment than non-AAPI. Some studies note that Asian American Pacific Islanders tend to utilize healthcare services less. Less than other races and ethnicities. And this study noted that Asian Americans or Pacific Islanders are less likely to actually talk about substance use with their primary care doctors. And so that's really important to know that you may have a patient that says they don't have a problem or they don't use a substance, and that actually may not be, they may not disclose to you that they are. We talked a little bit already about acculturation increasing with increasing English fluency and generations being born in America. And we can't talk about this topic and this model minority myth without unpacking how shame and stigma play a role, even amongst the Asian community, not wanting to talk about these problems to others. So in the NISARC epidemiology studies knowing that Asians, even though the samples were undersampled and underpowered, the Asian respondents noted that they were more likely to be afraid of sharing about their substance use to their boss, friends, family, and others. There are some other studies noting that substance use is increasing amongst the Asian American Pacific Islander populations. We know that after COVID, substance use is really increasing amongst everybody after COVID. But this is some studies noting from 2000 through 2012, increases in substance use rates, greater in certain regions and according to certain ages. But one of the data points was they noted that there was a 415% rise in opioid admissions amongst API over that decade in America. So, acknowledging that the rates are going up, even though they're probably undersampled, not underdisclosed, we are getting some data that it is still increasing. And earlier I shared this slide noting that there was the lowest rate of drug overdoses amongst API. I bolded and put in red that even though the rate may be, the raw absolute rate may be lower, the relative increase over 1 year was just as much compared to the other demographics. So 22% relative increase rate, and that was the same as white Americans. And so we are seeing increasing rates amongst Asian American Pacific Islanders. I think before I pivot into talking a little bit more about the study, I wanted to take a moment to kind of share how I entered this space too, and how I kind of stumbled into this space. As I finished my addiction medicine fellowship, I was doing this op-ed class and really felt like God, he planted a seed like way in undergrad where just a friend said, did you know that there was a Japanese American overdose epidemic in LA? And that little comment that he said way back when never left me, and so I ended up really, that became the op-ed that I wrote, and I shared about my family's experience, Japanese American experience through the war, how during the incarceration, a lot of young boys, teenagers, young 20-year-old boys, volunteered to fight for America while their families were interned in the camps to prove to America that they were loyal American citizens. They were the most decorated, the 442nd 100th Infantry Battalion was the most decorated unit in World War II because they were sent on suicide missions. They freed the Dachau concentration camp in Germany. And within the Japanese American community, we celebrate these heroes because they were true heroes. But I also talk about the dark side, about how American media also use them as a racial wedge to say, why can't other minorities be like these Japanese? So that was that second generation Japanese Americans. Their kids really suffered because their kids, so that generation, a lot of them were Japanese speaking. Their kids grew up in the 70s during the Vietnam War. They were English speaking, they were acculturated. A lot of that generation, my parents' generation, noted that they were frustrated that their parents wouldn't allow them to even talk negatively about the country or even ask questions. And so a lot of them turned to substance use in the 70s. And in 1971, there was an overdose epidemic, 31 Japanese Americans in Los Angeles, with the largest concentration of Japanese Americans overdosed from barbiturates. Many others died from cocaine use. But this wasn't captured in the medical data. I went through the LA coroner's data, and it's just not there. There's no overdose amongst Asians in the coroner's reports. In the community, though, in the Japanese American community, they documented these occurrences, and literally, and I talked to some people that lived through that time, they literally said it was family to family talking and just connecting the dots, that there was an epidemic that occurred that summer. And in this op-ed, I posed the question, after COVID, seeing the opioid crisis we're in now, are we going to miss another API overdose epidemic by ignoring it again? And is the medical community gonna miss this again? Little did I know that this op-ed would just kind of lead into finding out that community in the 70s, they rallied together and applied for federal funds and created the first drug treatment program to treat a community of color called the Asian American Drug Abuse Program, that's been around for now like 51 years. And they're still going strong to serve Asian Americans suffering from substance use in Los Angeles County. I mentioned to them, I did the op-ed, I want to maybe do a literature review, and then their prior CEO said, why don't you do a research study? We'll help you recruit, recruit Asian Americans to do a study and an interview, and so that's how this study was born. In the middle is Mike Watanabe. He passed this last year. He was their president for like 30 years. And he was one of them that lived through that time. And so I was just so honored to get to know him. I felt like God created an organization that I was made for, they were made for me, and just so honored they invited me onto their board and just been getting more involved in this space. But they really still have that 1970s civil rights spirit in their organization. And this is just a picture, and I put this article because this is the conversation, this is the national dialogue that they were living in at the time. And these were Asian Americans that were in recovery. A lot of these teenagers whose friends were the ones that overdosed started this organization. One of them, Nick Nagatane, literally formed this like ex-gang member group in LA called the Yellow Brotherhood. And it may be a lot to unpack in one small statement, but this small statement for me just captures everything regarding the model minority and racial wedge concept. But he said, we just got to stop this endless race of outwhiting the white man for Asians. So that's kind of the origins for this study. Go through, the study objectives were really to understand on a more nuanced level how cultural identity intersects with how participants view their own addictions amongst Asian API, and to look at specific roles that the cultural background plays in impacting access to care for substance use treatment. Our research question was just, how does API culture and upbringing help or hinder substance use engagement with substance use disorder treatment? We got IRB approval. We did a snowball sampling method, reaching out within the UCLA and LA treatment programs, recruiting for research participants. Get to the next slide. And the eligibility criteria was for adults 18 years and over who self-identified as API background, who self-identified as having had a substance use disorder addiction history, and that were an LA County resident. Over the course of a year, did semi-structured interviews exploring their pathway to recovery, often their childhood and how they initiated substance use, and also exploring the intersection with their cultural background in their substance use recovery journeys. And I also found that actually exploring their relationship with their parents along the way was really important for that conversation. And then we did a standard qualitative thematic analysis. We're probably about 75% through. And so actually I'm really interested to get your feedback. So if any of you even have time to chat or even send me a message on kind of what you thought about this presentation, we're getting ready to write the manuscript. So your feedback would be appreciated. Let's see, get to the next slide. So we had 20 participants. This was our table 1 on their demographics. Mean age was 45 years old. We had 35% who were female. Good spread of education and first, second, fourth generations. So we aimed to have a heterogeneous, we tried to capture a really diverse group of AAPI. Their background can kind of interpret it different ways. In terms of country of origin, 50% had originated from Japan, Korea, Philippines, and then China. We did have a Pacific Islander whose family was from Samoa. And then some that also had a half Italian background, half England background, or other backgrounds. So some people who were, half Asian, half another background. One patient that also had a Hispanic background, or I think particularly from Mexico. So maybe it's taken a little while to get to the next slide. Let me just break out of the presenter view. Okay. So some of the preliminary themes that have emerged and the larger overarching themes is we really saw a lot of the analysis being able to help unpack the model minority myth perception that increased stigma of their substance use disorder and also created barriers to treatment. We also unpacked some nuances with how their own family dynamics affected engagement with substance use treatment, and how culturally competent and concordant, so programs that had AAPI employees and staff, played a role in improving outcomes and some of the nuances of how that actually helped the study participants engage in recovery. For each of the sub-bullets, I have quotes, so if there's any that you're more interested in, we'll try to have some, I know we started later, so maybe we'll go, I'm not sure, maybe to 10:35. So if there's anyone that you're more interested in, let me know. I'll pull up the slide with a quote that kind of highlights that. But for this idea of the model minority myth, we found that it really led to a kind of a culturally imposed external stigma towards their substance use, as well as an internal shame that people carried. Some people even who grew up in that 1970s era noted that racism was alive and well. Some people that went into the military and fought in the Vietnam War noted that the racism they felt and experienced that at that time with racial slurs and that kind of playing into their substance use. One important theme that emerged that really correlates with this larger movement to disaggregate the data was that Asians weren't a monolith in the narratives. There was a spectrum of AAPI identities and stories that didn't all have one trend for 20 diverse people. And that even the stories that they're sharing themselves of their own substance use really itself contradicts this model minority narrative in society. And they also noted that shame was a barrier to them engaging treatment, noting that tradition, one participant noted that just tradition, you just don't talk about it with traditional Asians. Others noting that if they did engage in treatment, even their families would see it as a sign of weakness. Or even, they particularly said asking for help was seen as a sign of weakness. For the overarching theme of family dynamics, we saw that there was a lot of nuance there as well. So within the family, stigma played a role in often families hiding the problem, even self-denial, even containing it within the family, disowning their child. Trying to save face is a term that's sometimes used to preserve harmony. Some people noting a lot of suppression, active suppression, sweeping things under the rug. In terms of the diversity of AAPI identity, we saw a diversity of parenting styles. We saw parents treat children differently depending on their gender. Also, some parents having that model minority, high academic performance expectations on their children, even valuing academic performance and engaging in sports more than their own mental health like therapy appointments. Some people describing their parents as like tiger parents, and a trend to see it how when parents tended to display that overbearing parenting style, it tended to suppress emotional growth more. There was also kind of a spectrum of parents that were not overbearing, and people noting, one person noting that their father just didn't engage and was more kind of neglectful, kind of enabled the substance use. And then there were also stories of abuse and physical abuse. There were positive stories about how parents not only contributed to substance use at times with certain behaviors, but how there were positive behaviors that actually helped them then engage in the treatment too. And some people described it within the same parent, so the parent both helping and hindering their recovery journey. And lastly, with shame being a barrier to treatment, a lot of participants noted that when their parents just didn't know what addiction was, it made it very difficult for them to help or even support them engaging in treatment. Even some parents being afraid to ask for help, and so even maybe discouraging them from engaging in treatment. The last overarching theme on culturally competent and treatment programs improving outcomes, we saw that these programs that did engage culture, they always address the shame. Not only the shame that comes with addiction generally, but even the shame that comes with the participants being Asian American, Pacific Islander. A lot of them noting the moment they walked through the door, seeing another Asian American in treatment just gave them a sigh of relief, broke down stigma. Even seeing a staff member that some people described like, oh, they could be like my auntie, really helped them normalize and help them see themselves as not less alienated. Participants also noted that some activities that the programs had that really helped their recovery was they actually engaged the parents with parent support groups that helped the parents learn more about addiction and break down stigma within their home and even in that parent-child relationship, and also help the parents really dive into a lot of nuance, which Western drug treatment and even me doing addiction medicine doesn't really capture the nuance of how people describe how their Asian parents needed that support with counselors to help differentiate how some behaviors, to differentiate supporting behaviors versus enabling and enmeshment behaviors, and how this was really nuanced and important in collectivist Eastern cultures, where maybe the line isn't as clear as I was trained within my addiction medicine training, which is typically like just don't enable. But in these populations, it was a lot more blurry. Enabling was a lot more blurry. And then lastly, these programs, some people noted that as they went through recovery, they actually began to understand their identity more and shape their identity more through their drug treatment program. I think one participant stood out who was half Japanese, half Mexican, and he noted that growing up, he didn't engage the Asian side of him. But through the drug treatment program, he began to learn more about his Japanese American background and to gain a sense of pride and about that side of himself, and that increased his self-efficacy with engaging in treatment. And then lastly, noting that as these programs address shame, it helped to break down that barrier for engagement with the treatment programs. Okay, so last couple of slides is with these three overarching themes, I think what you probably heard now is this kind of complicated narrative of API that it's really diverse, really complex, and so we saw this paradox, this both positive and negative elements in different themes. And so for the model minority myth, although we saw that creating a barrier to treatment, there were other pro-social skills, coping skills that were associated with Asian values that help people into recovery. Some studies note that when Asian American Pacific Islanders do engage in recovery, they have the highest treatment success rates of completing the programs. So it kind of speaks to and it's important to note the risk factors and protective factors there. Within the family dynamics, we already talked a little bit about how parental behaviors could be and often were in these stories a major stressor that contributed to their child's substance use, but with support and education, their parents really became powerful supports in their recovery journey. And I think the gospel really shined a lot in these stories where people noted reconciliation with their parents towards the end through their recovery journey through this process. And lastly, while we talked about best practices are for programs to engage in this cultural competency and nuance, and when possible to have concordant staff that represent the populations we serve, these programs are very, very rare. All right. This is just a slide to note. So as we kind of close this topic, and I'll be around after this talk for conversation or Q&A as well. I did want to share kind of just some larger conversation within CCHF for some of the substance use providers and clinics. Recently, this last year, we formed the ARISE initiative to collaborate with Christian Medical and Dental Association's Addiction Medicine section to kind of share resources, pool resources together. So this is a collaborative between CCHF and CMDA that highlights increasing the standard of care, increasing integration of services into primary care settings for addiction services, and also increasing the integrity of the field, because we do, you're all here for a drug treatment talk, and you probably heard of drug treatment programs that just don't treat patients well or can be very profitable as well too. So trying to increase the integrity of the fields too. So that's a QR code to sign up for a newsletter. We have monthly Zoom meetings to do case discussions and try to continue the community between the national conferences. One deliverable that this ARISE collaborative was able to produce with addiction researchers and actually a dentist too was creating a free opioid use disorder CME course that's available to all of you at CCHF. It's on the website too. The relevance of this course is it's faith integrated for drug treatment, and it satisfies the new DEA requirements. You may all have heard that the X waiver was removed, so no longer required to prescribe Suboxone. But for all of the non-X waivered practitioners, to get your new DEA license renewed, you have to take an 8-hour CME. So a little bit of sleight of hand. So CCHF, CMDA collaborated to make a curricula that's faith integrated for our communities when they need to renew their licenses. All right. So here's some of those QR codes, also QR code for the slides today as well. But yeah, we'll go ahead and end here 10:35, but I'll be around for any Q&A. I just included a picture of a friend that I met at my first CCHF conference, Dr. Chris Valanco, who's a Morehouse, Atlanta, Georgia, psychiatric Filipino-American substance use disorder researcher. We got to collaborate and do a grand rounds together on this topic too. So I really just love this community, the friendships, and how these friendships spur some of these types of initiatives. So thank you. Yep.
Any recommendations on how to better screen for substance use?
Yeah, that's a good question. In the time of diving into like PubMed, I haven't seen any study on screening for this subgroup. Really, this topic's like not really discussed. So I think one is screening generally is important, but probably the recognition is to note that on our screening forms, their API may be more likely to check no and really it's yes. So it may be that personal rapport, that relationship that's needed to really kind of ask them in person. So creating that safe environment.